Hi Amber, we're going to put a sling under you, a fall arrest sling today, because we're going to use a piece of equipment to help you walk. So what I'm going to do today is I'm going to show you how to put a fall arrest harness underneath a patient while they're still sitting in the chair, because this is one of the tough things to do, is to get that harness underneath you, Amber. And we're going to use 2 friction reducing devices to do that. So the first thing we're going to do is we're going to fold the first friction reducing device, and you can do this with 1 person or with 2. And Amber, don't help me at all. I'm just going to slide it down behind the patient so you can see there's 2 layers. I'm going to take the inner layer and tuck it down, holding the top layer up, because we're going to place 2 of these and then slide the harness in between them. I'm going to come around in front of the patient because for the Rifton tram we do need the harness to go underneath the patient's buttocks. And how we do that is we're going to get the bottom layer of the bottom edge of the slide sheet, and we're going to shimmy it underneath their bottom. Now, I'm going to use my waist just to give a little bit of counter pressure back with her knees so that I don't pull her right out of the chair. I don't want you to land on the floor before we get the fall arrest harness underneath you. Okay? Then what we're going to do is we're going to take the second slide sheet and do exactly the same thing. Fold it in half. And the second one really goes in easy. We're going to slide it down. And again, there's 2 layers. Take the inner layer, shimmy it down. And then same thing. Once there's 1 slider underneath, we really do need to be careful not to pull the patient right out of the chair. So we're going to get the bottom edge of it, Amber. You're going to feel your knees in my belly a little bit. And again, we're just shimmying it down. And now we've got 2 layers of slide sheet underneath the patient. If the patient tends to slide out of the chair, you might want to have a second person in front. Now what we're going to do is we're going to take the fall arrest harness and slide it between the 2. You do want to make sure that the pale grey or padded area is next to the patient and that the leg pieces that go between the legs are facing down. And we're going to take the top layer, fold it forward. If the patient can help you at all, always have them help. There's no medals for doing more than we need to do, and it's always good to have the patient do as much as they can. So again, we're going to put these between the 2 layers, and you'll see that it just shimmies down real easy. Amber, you don't even need to lean forward here. You can just relax. Once we have the leg pieces down, we're going to do exactly the same thing. We're going to grab one of them on this side and make sure we get the one on the other side. And then same thing, we're just going to shimmy it down. I'm stabilizing with my tummy so that her knees don't come forward. And then once it's under, I'm going to take the top sheet and the person can come in with a lift. So we're going to bring the lift in and stand you up. And I'm going to take the top slider out. And you can see the patient's moving even on the slider because it's really slick. You'll see here that the harness is all the way under her. And then all we need to do is bring it underneath. And it's right there ready to hook up to the lift. Okay.
Remember, place your arms up here.
Go ahead and lean forward. And then we're going to hook up to the white. And we'll hook the leg pieces up to the yellow in the front. And the fall arrest harness is in place, ready to go. All right.
Amber, we're going to go ahead and we're going to have you stand up. And we're going to take a walk. So we're going to move forward.
Go ahead and stand up with the lift.
All the way up.
We can take the other slide out. And then, Amber, we're ready to go for a walk?